Good day, sir. My name is Jonalyn Siasat from St. Augustine School of Nursing under Caregiving Program. For today's video, I will perform sunctioning. Sunctioning, clear mucus from tracheostomy tube and is essential from proper breathing. Also, secretions left in the tube could become contaminated and chest infection could be developed. Avoid suctioning too frequently as this could lead to more secretion build-up. Draw pharynx. Extend behind mouth from the soft palate above the level of the yoid bone and contains the tonsils. Nasopharynx is located behind the nose and eyes to level of soft palate. Purposes of suctioning: removing the secretion through the airway, facilitating the ventilation, obtaining the secretion for diagnostic purposes, preventing the infection. Procedure: verify the physician order and identify the client to prevent potential errors. Wash your hands. Hand washing prevents transmission of microorganisms. Explain procedure and purposes to the client. Explanation reduces anxiety and encourage cooperation with procedure. Good day, ma'am. I'm Jonalyn Siasat, your aide for today. May I know your name and age, ma'am? Thank you, ma'am. Position the client. Position the conscious client with an intact gag reflex in semi-Fowler's position. The semi-Fowler's position helps prevent aspiration of secretion. Position the unconscious client in a side-lying position facing you. A side-lying position facilitates drainage of secretion by gravity and prevents aspiration. Turn on suction device and adjust pressure for the infants and children 50 to 75 mm per mercury. For adults, 100 to 120 mm per mercury. Excess negative pressure traumatize mucosa and conduce hypoxia. Open and prepare sterile suction catheter, tube occlusion test suction apparatus. High pressures cause excessive trauma without enhancing secretion removal. Unfold sterile cup touching only the outside. Place on beside table. Pure sterile saline into cup. Pre-oxygenated. Client 100% oxygen. Hyperinflate with manual resuction bag. Pre-oxygenation. Prevent hypoxia. Hyperinflation decreased atelectasis caused by suctioning. Don sterilized gloves if kit provides only one glove. Place on dominant hand. Dominant hand will remain sterile. You may use a clean disposable gloves on the non-dominant hand to protect yourself from exposure to mucous membrane and system. Pick up catheter with dominant hand. Pick up connecting tubing with dominant hand. The non-dominant is now considered clean rather than sterile. Attach catheter to tubing without contaminating sterile hand. Place catheter end into cup of saline. Test functioning of equipment by applying thumb from non-dominant hand over open port to declate suction. Lubrication makes catheter insertion easier and ensures proper functioning of suction equipment. Insert catheter into trachea through artificial burning inspiration. Inspiration opens epiglottis and facilitates catheter. The side of the mouth prevents stimulation of the gog reflex. Advance catheter until you feel resistance. Retract catheter before applying suction. Note client usually will cough when catheter enter trachea. Retracting catheter slightly diverts mucosal damage. Apply suction by placing thumb of dominant hand over open port. Rotate the catheter with your dominant hand as you withdraw the catheter. This should take 5 to 10 seconds. Rotation of catheter prevents trauma to mucous membrane from prolonged suctioning of one area. Limiting the suction time to 10 seconds or less prevents hypoxia. Hyperoxygen and hyperinflate. Using manual resuscitation bag for a full minute between subsequent suction passes. Encourage deep breathing. Prolonged suctioning can induce hypoxia. Rinse catheter and tubing by suctioning saline through. Rinsing clears secretion from catheter. Repeat step 10 to 14 until airway is clear, limiting each suctioning to 3 passes. Without applying suction, insert the catheter gently along one side of the mouth. Advance to the oropharynx. Rationalex suction the oropharynx trachea because the mouth is less clean than the trachea. Directing the catheter along the side of the mouth prevents stimulation of the gag reflex. Apply suction for 5 to 10 seconds as you rotate and withdraw catheter. Rotation of the catheter prevents trauma to the mucous membrane. Be sure to remove secretion that pull breath, the tongue, and in the vestibule of the mouth. Allow 1 to 2 minutes between passes for the client to ventilate. Encourage deep breathing. Replace oxygen if applicable. Repeat step 16 and 17 as necessary to clear oropharynx. Rinse catheter and tubing by suctioning saline through. Remove gloves by holding catheter with dominant hand. Any pulling glove off side out, catheter will remain coiled inside the gloves. Pull other glove off inside out. Dispose of in trash replicable. Contain client secretion inside gloves to reduce transmission of microorganisms. Turn off suction device. Assist client to the comfortable position. Offer assistance with oral and nasal hygiene. Replace oxygen device if used. Accumulated respiratory secretion irritate the mucous membrane and unpleasant for the client. Dispose of disposable supplies. Wash your hands. Ensure that sterile suction kit is available at head of bed. Provides immediate access to suction equipment when needed.